Hello, everyone. It's so nice to be here, even if it is virtually, and speaking again about integrative heart health. Of course, something that I am very passionate about. And this year has been such a challenging one for everybody. It is nice to come back and think about things that we can do everything in our power to prevent for future health. So I'm going to start off with just a brief overview and my view in terms of a cardiologist, especially a female cardiologist. I like to think about what the image of heart disease is, and I want to make sure that everybody is on the same page and we have a correct image. So this is what society and the media would have you believe that heart disease is. But the truth is, and I like to start off with this, and usually I have question and answers. It's hard to not have people speaking back to me, but I like to start off with these myth versus facts. So most women die from cancer. Is that true or false? Well, it's absolutely false. And heart disease has been the leading cause of death for women since 1908. 6 times more women will die from heart disease than will die from breast cancer. And heart disease will kill more women than all forms of cancer combined. So heart disease is a man's problem? No, absolutely not. So until 2012, more women than men died of cardiovascular disease in North America every year from '84 when they started these statistics. It wasn't until 2013 that the number of deaths of women fell slightly below those of men. The problem is that women are still twice as likely to die after a heart attack than a man is, than their male counterpart. So I just like to show this statistic. This is the most recent. I think they might have just come out with the 2016 data, but it's very similar, showing just the absolute numbers, which are 400,000 deaths per year in the United States attributable to heart disease. And you see how clearly, overtly larger that is than all the other forms of death. And the mortality trends, I like to show this as well, just to show you how women in red, just at 2000, like I said, at 2013, they finally reached the same mortality, but their mortality rate was higher for all these years. And they think that this change, this drop and this equalization has a lot to do with the Go Red for Women campaign, which is really great. And what I'm here for, and most people out there talking about women's heart disease is. So what are these issues that cause the disparity between male and female heart disease? Well, it's community awareness and prevention. So 1 in 5 women actually think that heart disease is their greatest risk. So that means 4 out of 5 think that they're more likely to die of something else. And now knowing these numbers, you think, how can that be? Well, it's all about what the community hears and what the media projects. So understanding symptoms and why there would be a delay in seeking treatment. We're going to talk about that a little bit, but we're here to close the survival gap. And again, I just like to start with this in all talks because it's so important to me, again, as a female cardiologist and getting that word out there to the community. So what is coronary artery disease? What is this heart disease that is this #1 cause of death? So you also hear it described as atherosclerosis or arterial sclerosis or hardening of the arteries. And basically it's the buildup of plaque, which is a substance made almost like a waxy substance made of fat and a lot of inflammatory cells. It builds up in the wall of our heart arteries. And because of that buildup, a clot can form right on top of it and it can cause complete blockage. Now, this is what a complete blockage would look like when you go to the cath lab, which you never want to go to, but this is where somebody would go if they were having a heart attack, for example. This is the picture that the interventional cardiologist would see. And you see that nice little narrowing in there that they try to open up with stents or angioplasty. So again, a heart attack occurs when blood flow to a section of heart muscle becomes completely blocked, most often as the result of coronary artery disease. And here is a very clear picture of the plaque buildup and then the clot form right on top of it to block all blood flow downstream. So the causes of heart disease are the plaque buildup, and also there's this hardening of the arteries. The arteries can become thicker, especially in diseases like high blood pressure. And there's also microvascular coronary artery disease, which is again more common in women. So think of this as blockage of the vessels downstream. So think of it like the little tiny tributaries at the bottom after the big river. Those little tiny vessels can also become blocked because they also can become thickened, hardened, and not relax as they should. That's called microvascular disease. So how is all of this diagnosed? Well, that's what we do in the cardiology office every day. We do things like EKGs and echocardiograms, which are ultrasounds to show how the heart pumps. We do stress tests where you walk on the treadmill at a fast pace under monitoring. We do nuclear stress test in which you have a picture taken of the heart with a nuclear tracer agent. Then there's things like CAT scans of the heart arteries. There's calcium scoring now that we do in order to try to figure out if somebody actually has plaque buildup before they have an event. And then, of course, there's cardiac catheterization, which is the picture I showed. And that's where you go when you have an abnormal stress test, or if you're unfortunately in the setting of a heart attack. So it's treated by medications, by stents and angioplasty, by bypass surgery, by things like cardiac rehab, and most importantly, what we're here to talk about today, it's treated by lifestyle. So another myth versus fact. If heart disease isn't in your family, it really isn't a problem for you. Well, unfortunately, that's not true either. But we know that now because for years we've known actually there's risk factors that you can control for heart disease, and there's risk factors that you cannot control. Of course, those cannot control, it always comes back to the family history. And even some of the healthiest people that come into us with heart disease, their dad had it, their mom had it, their grandfather had it. So it's something they always had to have in their mind and be aware of. But then there's those risk factors you can control, like smoking, high blood pressure, high cholesterol, being overweight or obese, being inactive or living a sedentary life, and diabetes and even pre-diabetes. Of course, the other risk factor you can't control is age. We all wish we can control age, but it keeps coming year after year. And we have to think about heart disease very seriously in those males over 45 and females over 55. So there's a lot of other risk factors. Most patients have heard about the ones we just discussed, but there's other things that always should be asked about in my mind, especially if you see a cardiologist. And that is when, for example, a female went into menopause, if that was earlier than 50, if they had preeclampsia or some type of pregnancy-associated adverse outcome, if they had dysfunctional ovulation or abnormal periods, if they had breast cancer, and if they were ever radiated to the chest or received chemotherapies. Then there's autoimmune disease like lupus and rheumatoid arthritis. There's stress and depression, also known to cause increasing prevalence of heart disease. So we know for quite some time now, but it was probably about the past 15 years that this really has made headway, that inflammation plays a large role in the development of atherosclerosis or coronary disease. There was a big trial that really made a lot of headway in cardiology that came out now 12 years ago. It's hard to even believe, that showed that even those with normal cholesterol levels, if you had this one increase in a inflammation marker that we could check in the blood, those patients actually had higher risk of heart disease. So the question is, well, what causes that higher inflammation? Well, we know things like a poor diet, a sedentary life, a lot of stress, then things like colitis, arthritis, gum disease, toxins that you can be exposed to, all can cause this underlying inflammation that you wouldn't necessarily know. So it's important to always think about that in terms of what kind of risk factors may I have? So now the question is, if you have a risk factor, what do you do about it? Well, most importantly, it's identifying that you know you have one of these things and being proactive and making appointments to say, you know what, I want to be preventative. I want to get all these things checked out. I want to go tell my doctor about what I'm worried about and what my family history is. And I know that I'm at that age now. and you want to know, what kind of numbers do you have? What do your cholesterol numbers look like? What's your blood sugar look like? How's your blood pressure? And what kind of things can you do to get those to goal? Then together, and I always say this, it's so important to me, together you're going to come up with a treatment plan. You're not going to listen to the doctor and say, oh, sure, I'll take whatever you tell me, and walk out and just say, forget it, I'm not taking that. You're going to actually be honest and say, you know what, I'm not sure about this. I don't really know if I'm comfortable yet. It's so crucial in terms of trying to get to the right goal together. So the numbers we talk about are the cholesterol numbers, the triglycerides, the blood pressure, the blood sugar, what your body mass index is. So what is your weight to height ratio? That's all calculated in every visit, at least with your primary care and cardiologist. So important to ask. Also, that target number for exercise is 30 minutes a day. So again, exercise, according to the American Heart Association, is physical activity. So you think about physical activity and say, well, what's the last time I did anything where if I tried to sing, I couldn't hold a note? I'd have to say, oh, take a breath. That's physical activity, not training for a marathon. So don't think of it as so overwhelming for yourself. So what does a heart attack feel like? Well, I usually use this slide because it was used for women, but it's important for all. So it can be anything from the belly button to the earlobe. So think about it like most obviously chest pain, but then there's also pain between the scapula, pain in the upper back, sweating, nauseousness, vomiting even, feeling just terribly fatigued, as if you just can't put your finger on it, but something is just not right, and shortness of breath. So again, myth versus fact, you can't do anything to stop heart disease if you have a family history especially. Well, this is why we're here today, because it is absolutely untrue. 80% of cardiovascular disease is preventable. Prevention is mostly lifestyle change, sometimes medication, and that's why we call this integrative medicine, but lifestyle change is where this is all going to come down to. So the strength of what we do in Western medicine is in the acute care setting. It's getting the diagnosis with all of our wonderful imaging and our stress testing and our CAT scans and the catheterizations, having surgery if you go in with a ruptured appendix, getting a stent placed if you go in with a heart attack. That is where we are best. But we know we are not the best at prevention. We know that. We actually have something called ill to the pill, where you can actually have medicines treating you for one problem that can cause others. And this is something we see in cardiology every single day. So say, for example, you'd have to take Aleve or Motrin for your arthritis. Well, now weeks later, you develop high blood pressure. Now you got to take a blood pressure medication. Now you're having constipation from your blood pressure medicine. Now you're taking something for that, and it can become a vicious cycle. And we know this is not where we want to meet that patient. So what is integrative medicine? It's a practice of medicine that focuses on the whole person. It is the use of evidence. It makes use of all different therapeutic approaches and different disciplines to achieve optimal health. So think about integrative medicine as, I'm going to also think about using the medicines that my cardiologist talks about, but I also have to start thinking about my nutrition. I have to start thinking about my mind and body. I have to start thinking about exercise. And maybe I could use something like acupuncture, or maybe I can use something that I heard about in botanical medicine to try to help. It's using all different avenues. Integrative medicine thinks about the body as a tree, right? So we have our tree is our organs and our systems, but it is the roots of the tree that we are trying to get to the bottom of. We are trying to heal those roots. We are trying to make sure that that soil that those roots are in is beneficial. And that's where we talk about the nutrition. We talk about physical activity. We talk about sleep. We talk about our spiritual and social health, emotional and mental health. All of that is going to help the roots. If the roots aren't good, think about it. The body's not going to be good. So I always have everybody try to walk away from any of my talks with this acronym, because prevention is the best intervention, especially for cardiovascular and holistic heart health. So if we don't think about it simply, think about fresh. F, think about the food that you're putting into your body. R, think about the relaxation. What are you using to relax? What are you using to bring yourself down? Especially during this past year, everybody has been seeking that relaxation point. Exercise, E, trying to decide, what am I going to do to keep my body active? I have to keep physically active. We know there's benefits. S, sleep, so critically important for cardiovascular health. And mental well-being. S is also for social network. Who is your social support? Who are you going to? Do you feel isolated? And then H is the pursuit of happiness. So it's that idea that, what did I do today to make myself happier? Where is my mental state today? So this is a nice quick acronym that I use frequently. I use with patients, I use myself when I kind of try to recenter myself in terms of, what am I doing to prevent these issues that may be coming up in my life, medically speaking. So we always start with food, because food and nutrition is by far the backbone of all cardiovascular disease prevention. And this is not new. This is something that's been talked about in the days of Hippocrates, the founder of integrative medicine, as so they call him. Let food be thy medicine and medicine be thy food. And this has been proven over and over and over again. There is not one cardiologist that will not say that nutrition has a huge role. So we know there are multiple studies talking about the benefits of dietary change. Mediterranean diet, you've heard many times, I'm sure. This one study, which is called the Lionheart, dates back to 1999. And I just point this out because it kind of really established the fact that we could use more than pills. And it said that after heart attacks, these patients who were put on this Mediterranean diet and followed it strictly decreased their recurrent heart attack event by 70%. They actually had to stop the study early because it was so clearly, obviously better. And again, I like to show this pyramid because it's all based on fruits and vegetables. So when you think about it, well, is a vegetarian better? Is a vegan diet better? Yes, there are schools of thought that will say yes, that they are better. But as you see, the basis of the Mediterranean diet is also fruits and vegetables. You have your nuts and your legumes, and you're going to have fish and seafood in there. You're going to have lean poultry. Very, very infrequently are you going to have meats. But it's so critical. It is, as I said, the backbone of prevention. The DASH diet, patients maybe have heard about if they have been diagnosed with high blood pressure. It was a diet that was put out also in the 90s by the American Heart Association. A dietary approach to stop hypertension. That's what it stands for. Again, look at the bottom, based on fruits and vegetables. I always tell everybody with high blood pressure, your goal, if you have high blood pressure, is to have higher potassium intake than sodium. Sodium is always something that we know contributes to high blood pressure. And where are you going to get your sodium? You're going to get it in breads, in carbohydrates, in your condiments, and all your potassium is going to come from your vegetables. So if you can balance that out, where your potassium is higher, you're going to get rid of all of that extra sodium. So it's important. That's why vegetarians and vegans very rarely hypertensive. So food is so critical to our prevention and in terms of getting that word out to patients, that it started about 10 years ago now that they started finally teaching culinary medicine in medical schools. So now we have all sorts of programs, because when you go through a typical medical school training, it used to be you would hardly get any nutrition training. 10 years ago, the tide really shifted, and they have really tried to incorporate this because of how important and how clearly obvious it was that this is something we need to be preaching. There's all sorts of courses now in terms of getting that information out there to the medical profession. Okay, so physical activity, how critically important is this? Well, there are some that say we should be writing prescriptions for it. 30 minutes a day, and then weighted exercise twice a week, resistance exercise. we need to take a stand against the sitting disease we have in this country. It has been proven that sedentary lifestyle increases your mortality. So those patients who are sedentary will die earlier. Active patients stay alive longer. That's been proven for ages. And the physical activity, while most importantly, it won't make you lose a lot of weight, it will keep you active and keep away from a lot of the medical problems that come with sedentary life. We know how important this is because huge companies like Apple and Fitbit have been booming in the past 10 years because everybody knows that we need to get away from this. Using a little wristband or a watch to tell you it's time to get up and go for a walk, sure, great idea. All of these things are for benefit. Even medical centers, as you've probably seen, Valley has this beautiful lifestyles gym. Up in Mahwah, there's most of the medical centers in our surrounding area now have fitness centers because of the importance of it and how critical it is in terms of maintaining health, rehabbing from medical problems. It is critical. We here at Valley also have started a walking program in which we try to walk with patients. We usually do it with one or two of the doctors. It was going great until pre-COVID. It's called Valley Walks. We do it once a week. I have been a participant many times. It is a wonderful outreach to the community, and I encourage anybody who's interested to, how can I get out there? I'm not sure how to even start. Well, this is a great place to start. It's just a nice social walk. And again, one day I hope we look like we do in this picture where we're all together and laughing and talking. So supplements, another big thing in terms of prevention. It's really unbelievable. Half of US adults have used some type of dietary supplement, and supplements are in a $30 billion a year business. I did not know that until recently. And most people use them to improve, prevent, and maintain health. So the question is, do they work? Well, there are a lot of small studies in cardiology. It is one field in which supplements are used regularly. I could tell you almost, I would say definitely more than 50% of my patients are using something. There have been studies that show a lot of benefit with omega-3s. Another smaller study just recently came out that maybe it's not as good as we thought. It kind of goes back and forth. It's still in the guidelines that it could be beneficial, especially with high triglycerides. There's things like magnesium that are very useful in things like palpitations. There's things like vitamin C that have been found to be very anti-inflammatory. There's things that, for example, plant sterols or stanols can be used. It's basically pulverized plants, another way to get in fiber, used to get cholesterol down. Again, many things useful without having to necessarily take prescribed medications. Also thought of as an integrative way to try to get things going in the right direction. Botanicals, I mentioned earlier, there's a lot of anti-inflammatory botanicals out there. That is a lot of what Chinese medicine is based on, is inflammation and trying to get that inflammation level down. You've probably heard of things like turmeric and ginger as anti-inflammatory supplements. People throw them into smoothies. Things like green tea can be very useful in prevention. So mind-body approaches, so critically important. So the stress response, and everybody knows, I'm sure, a lot about this year. We've had more stress-related medical issues come out this year than have in probably decades. So what do we know about stress? So it increases your sympathetic over your parasympathetic tone. So think of it like our fight or flight mechanism can be put into overdrive. And all that does is make everything else in the body go to the negative. So your ability to maintain your blood sugar goes wrong. Your blood cholesterol can go up. You have high heart rates that are not healthy and sustained for high periods of time. And of course, most consistently seen in the cardiology office is stress-related high blood pressure. So again, perception is everything. All of us in our lives have some level of stress. It's how we perceive it. and how we can learn to modify our stress response. For example, these two on a roller coaster ride, one having the time of her life and one scared. So again, it's how we perceive that stress and what we do in terms of how to manage the stress. So there is something called the mindful revolution that has been, I would say, been going on for, again, at least 5, maybe more years. And again, we see this with the opening of yoga studios, meditation sessions, within a stone's throw from most of our houses here in Bergen County. We know that becoming mindful and more at peace and more with the current environment, understanding what's happening, not being afraid of yesterday or tomorrow, is how we can try to calm the mind. So things that have been found and studied and useful are things like meditation, guided imagery. So it's very interesting. I always talk about guided imagery because most people know Dr. Oz and how he became who he is today. He started by going around and doing guided imagery prior to doing open heart surgery on his patients to calm the anxiety, and found that those patients did better. So that's a very real thing. And meditation actually is one of the very few integrative techniques that's in the guidelines in terms of one way to get blood pressure under control, if you can imagine. Yoga there's actually a thing called cardiac yoga. I was actually privy to be a student of cardiac yoga, which was very amazing. And I have seen many, many of my patients benefit from yoga after cardiac events. It has been found to do everything from reduce blood pressure, improve heart failure, ease palpitations. And most importantly, although yoga won't cure heart disease, it will help your ability to cope with most disease states. Tai Chi is another thing that you see often out there in the community. It is notorious for helping balance and stability, but it's also helpful for heart failure patients. It's been studied in heart failure patients. There's things like biofeedback that have been used for stress reduction. There's something called heart math that you can actually purchase yourself and use on something like a smart device, where you actually put a little sensor on your ear and it measures your what's called heart rate variability, so your ups and downs of your heart rate, and guides you through meditation and breathing episodes, and you watch as your heart rate comes down to a nice, calm, and even flow. It's pretty amazing. We've seen it here at Valley. We've used it a few years back, and it was great. And it's very good for patients to have at home. Breathing exercises, these are simple things in terms of trying to maintain composure, get back centered, to calm the nervous system, reduce stress. Belly breathing is a very simple way to do this. This is done in almost every integrative conference that I've been at. We start the conference by sitting at the edge of the chair, back up, one hand on the belly, one on the chest, breathing in to a count of 4, breathing out to a count of 7. Again, the deep breathing, just like in yoga, is known to decrease heart rate and decrease that sympathetic fight or flight drive. There's something called mindfulness-based stress reduction, which we have courses here at Valley and most hospital systems offer. And it's a way to bring together mindfulness meditation and yoga exercises. So helps to calm the mind, helps you cope. Again, that word cope teaches you to focus on things happening at the present, awareness of your body and your mind. And it's been proven over and over again to help with quality of life. I think that's why every hospital system will offer it. So I'm going to end there, and I'm going to remind everybody to think of their heart during this Happy Heart Month that we are now in. And again, remember from the beginning of my talk, heart disease is both a male and a female problem. Always remember that. Remember to think about heart health in terms of emotional, physical, and spiritual well-being. Thank you so much for listening tonight.
Thank you, Dr. Burke. We do have a few questions that have come in, and I would like to remind everyone, if you do have a question, to submit it in the Q&A tab at the bottom of your screen. The first one is, what is a healthy LDL?
So a healthy LDL. LDL is the bad cholesterol that we, low density lipoprotein is what it stands for. It is the bad portion of the cholesterol panel that you get drawn with your primary care doctor. And healthy is considered less than 100. That's the rule of thumb. We try to get it even lower than that on patients who we have already known to have heart disease or atherosclerosis. We use statin drugs, and of course, nutrition and exercise all benefit the LDL. But generally, yes, it's less than 100. The history was that it was always considered 130, and now that number is really being moved because the outcomes are better with patients a little lower.
Okay. Also, there was a question about eggs. Are eggs bad for your cholesterol?
So that's a great question. And that goes back and forth in the literature every year. In 2015, the nutrition guidelines stated that cholesterol, which is what is mostly found in egg yolk, is not necessarily correlated with your own cholesterol, your blood cholesterol. So that really changed things up a lot in terms of our recommendations. There was this a study that said 6 eggs a week is not beneficial for a diabetic, then another study that negated that. So I think I'm going to have to go with the nutrition dietary regulations that came out most recently and say that I am not as concerned about eggs anymore. I think that they provide a lot of protein and can fill you up. That's much better than having a bowl full of carbohydrate-rich cereal, for example.
Okay. Does the same go for shellfish?
Yeah, shellfish, same thing. It's their biggest issue is the cholesterol content. Again, it's a little different. They don't have as many of the benefits as the eggs, as many of the nutrients. So it's a little bit different. I probably would go more towards eggs than shellfish, but again, it wouldn't be something I would stay away from. I'm a big proponent of fish. I think that fish has been proven time and time again to be beneficial for heart health. Shellfish, not as much as your typical whitefish or salmon, but again.
Okay. Is it possible to improve your calcium score? And if so, how?
And the answer is no. A calcium score is an established calcified plaque. So calcified plaque, which is that buildup that we talked about in the arteries, as it gets older, it calcifies. And surprisingly, we want it to calcify. We want it to stay hard and stay stable. We don't want it to get fluffy and fatty and grow. We want it to have that calcium build over it and keep it nice and steady. So in terms of improving that number, usually we do these calcium scores, patients ask for them again years later, and they are worse. The numbers are higher, meaning, and we don't know what to make of that because we want that number to be higher. We want that calcification process to continue. The problem is we cannot reverse it. It's only going to get higher because of the plaque getting more and more calcified over time. It's a difficult question, but no, it's not been found to be something we can reverse.
Okay, and this question came earlier in your presentation, and I know you mentioned turmeric, but fish oil. Do you recommend fish oil?
So right now, fish oils are being recommended only for high triglycerides. They have a lot of anti-inflammatory properties. So patients of mine that have high inflammation states, I may recommend it. If they're not, for example, on other blood thinners, because they can also cause a very mild blood thinning effect. But so it's a little bit more complicated. I need to know each patient. But high triglycerides, it is established as a treatment, yes.
Okay, and on the inflammation component, is there a blood test for inflammation that should be part of an annual physical?
So yes, the highly sensitive CRP test is a established test that is generally sent by cardiologists because we're the ones that are most interested. Again, it's one of those things that it's difficult to know exactly how to treat, but we would take that into account when thinking of somebody's risk in terms of their cholesterol. So that's one inflammation test that is useful. In integrative medicine and functional medicine, as some people have heard of, they do a lot of different inflammatory tests that I can't say have as much data behind them, but the HSCRP definitely does.
Okay, what can you do if you naturally have high cholesterol?
Well, most importantly, from my standpoint, if you're in that age range where we need to think about coronary artery disease that I mentioned, 45 for males and 55 for females, I would want to get an idea if you have plaque, if you are one of these, as we call, bricklayers. If you have high cholesterol for most of your life and you're living a healthy lifestyle, the question is, are you making plaque? And that's what those calcium scores that I talked about really have helped us in terms of what to do with these patients. And so you may want to talk to your doctor about something like that.
Okay, are you currently accepting new patients at your office?
Yes,
Okay.
always.
Can you comment on using Ropatha instead of statins to lower cholesterol?
Oh, sure. Ropatha is the injectable, what we call the PCSK9 inhibitor. It is now useful in those patients in whom we cannot get their cholesterol down, and we know they either have heart disease already or they are very high risk for heart disease. We can't get their cholesterol down adequately, or they just cannot take the statin drugs. They have too many side effects, and so they cannot take them. And so we use these injectables now. Patients are doing much better in terms of less side effects, but a lot of patients reasonably don't want to take injections. And we have a long conversation about that in the office. And if we feel that this is going to be beneficial long run.
Okay, can you explain how a calcium ultrasound works and why it's beneficial?
Okay, so a calcium ultrasound, is that was the question?
Yes.
Okay, so no calcium scores, I think is what the question is. Calcium scores are not ultrasounds. Calcium scores are CAT scans of the heart, no dye, in terms of looking to see if plaque is already developing. It is a prevention test that we use in terms of trying to decide how high risk somebody is. Ultrasounds of the heart are used to look to see how the heart is squeezing, how the valves are doing, also known as an echocardiogram. We also use ultrasounds to look at the carotid arteries to see if there's any plaque buildup there. That's another reason for using ultrasound in terms of prevention.
Okay. What's the best way to lower triglycerides?
The best way to lower triglycerides is to take out simple sugars from your diet. So alcohol is the biggest culprit in this country because of the carbohydrates and the simple sugars that are in wine and beer, for example. Sweets, just anything sugary in general is going to be carbohydrate-laden foods have to be cut out in terms of trying to get that number down. And then exercise has been proven as well.
Okay. Can you explain lipoprotein A?
So lipoprotein A is a very small component of the bad cholesterol. It is now measured as a marker for early heart disease in patients. You can get a blood test drawn if, for example, you had a family history of heart disease at an early age, meaning before the age of 60. It's a difficult test because at the current time, we have no therapy for it. So while we find it high in some patients, it gives them the whereabouts to know that they are high risk and that potentially changing their lifestyle, as we discussed during this whole talk, may help them. We don't have any drugs or therapies, even integrative, that are targeted towards Lp(a) that have been proven, I should say, targeted towards Lp(a) right now.
Okay, there were a couple comments. Can anybody go to the Valley Gym? I can answer that. It is a gym membership, but it is open to anyone. You can come for a tour, and it's actually where my office is. It's a great place to work. But if there's something that you want to add for that, and then where is your office specifically?
Oh, I'm right across from the duck pond in Ridgewood, on Ridgewood Avenue, East Ridgewood Avenue.
Okay. Let's see what else we have. Is it okay to use turmeric if one is on cholesterol and blood pressure medication?
Absolutely, yes.
Okay. And oatmeal. What about oatmeal?
Oatmeal has been proven to decrease cholesterol. It's a good way. It's a reasonable way to do it. It can be used to pull some of the fat in your diet out of the gut rather than having it absorbed. So it's good.
Okay. What about taking a baby aspirin daily?
So that's a very individual question. Every single person has to be looked at in terms of all of their risks to determine if they would be somebody who aspirin was warranted in. Very individual.
Okay. What is impact of clumping platelets?
So I'm not sure if that person means if they're, clumping platelets is how clots are formed. So platelets and a lot of proteinaceous material combine to form the clot, which is what I showed earlier in the pictures, the picture representation of coronary artery disease and heart attacks. So clumping platelets is never good for us, but of course it's good if you're bleeding because you need that to happen to stop the bleed. That's what aspirin tries to prevent. It takes much longer for those platelets to clump, which, in some patients in whom cardiovascular disease is a real risk, or if they've had cardiovascular disease before, that's why they're on aspirin, just to slow that process down. But I hope I got some of the things that person was asking.
Okay. Who should use statins?
So again, making that decision is very individual. It's based on a lot of risk factors. There is something called the ASCVD risk score now, or our atherosclerotic cardiovascular disease risk score, that any doctor can plug in multiple bits of information about you as an individual, from your age to your blood pressure numbers to your cholesterol numbers, in terms of trying to decide what your actual risk is for heart disease over the next 10 years. And we use that a lot in terms of deciding if somebody should be on a statin or not. But most important, it is trying, if you get that bad news about the cholesterol being high, it's seeing what you could do on your own with changing in lifestyle. And again, that's what this whole thing was about, just to say, I have the power to do this. And I see this every day in my office. And this is real. It's not just on The Biggest Loser. People do this. They make changes. They come back 6 months, maybe they take a year, and they can get themselves off medicine or out of the window where they would be recommended medicine. And it's just a matter of understanding what your risk is and saying, I'm going to do something about it.
How do you feel about using red rice yeast instead of a statin?
So red yeast rice is something that in my practice, I am okay with in some cases. I think that patients who are relatively low risk, but have cholesterol numbers that are not perfect, I think it's reasonable to try. I hate that there isn't any FDA purview over the red yeast rice. That's my problem. You know, so we try it. We try some of the more reasonable brands, and we see if it makes a difference. Now, again, you're still putting a foreign substance into your body. So a lot of times we have this conversation where I know what's in Lipitor because the FDA has to overview it. I know what's in Crestor because the FDA has to overview it. I'm not exactly sure what's in that red yeast rice pill, and I'm hoping that it is what we think it is, which is just the plant product. But we have that conversation often. And you know, sometimes the patient chooses that way, and that's okay. I think it's worth trying. It's worth doing something. Like I said, 50% of adults in America will use a supplement, and that is one of them. And I think as long as you're doing it safely and not cross contaminating with something else, then it's worth a try.
And now I'm not sure, this question might be a little specific, but do you do biofeedback at your hospital? And is that something that insurance generally covers?
So insurance did not cover it, and that's why we stopped doing it, because the cost, unfortunately, was prohibitive in most cases. So it's because it takes a person running it with you and being there to go through the meditation. And that's why I mentioned heart math, because it's something that you can now order on your own. You can order the sensor and you can use it on your smart device. But yes, we don't offer it anymore, unfortunately.
Okay, and we have a lot of questions about oatmeal. Regular versus steel cut oats, and instant versus the normally cooked. Is there a difference for reducing cholesterol in the different types?
Yeah, instant is more processed. So you don't want to use that. You want to use something that your body is going to have to work harder to process. So that's the steel cut and the overnight. So definitely that, if we're looking for beneficial results in terms of cholesterol, that's where you want to go.
Okay. Bring back the walks with a doc as soon as we can safely gather together. There's a comment. Does high HDL help negate high LDL?
Yes, it does. We've known that for years and years and years. So that's a very good sign. And a lot of times it takes patients out of the high risk category. So it's important to look at the whole cholesterol profile together with your doctor. Mm-hmm.
Okay. I think that looks like most of the questions. I'm just double checking.